My name is Dr. Rick Saguil.
And action. Hey, Jay had a... This is Kirk again.
Stress and investment.
And action. Hey everyone, it's Dr. Rick, and Connor had a question about what causes low T. Whoa! Almost poked myself in the eye with a corner. So, what causes low T? Low testosterone is common with age. And it's supposed to be common as you get older, like aging into the 60s and 70s. But it is coming down to an earlier age. I've had a couple of people with low T, low testosterone, even in their 20s. I'll talk about the reasons why in a second, but if this is the first time you're finding me, hit the subscribe button and hit the alert button to find out when I do new videos. Alert bell. So low T. I do have a couple other videos on low testosterone, so I'll put them down below. And it could also be something that's felt in women too. Decreased sex drive, pretty quick weight gain. That can be poor muscle responsiveness, can be from low testosterone. Women make testosterone just like men make estrogen as well. In fact, I don't know if I mentioned it, but when I test for low T, and listen, if you got the symptoms, as long as I rule out anything else, then I'll still treat you, but it's nice to know the numbers beforehand. So when I have a test for low T, the test has to be done early morning. I usually say 6 to 6:30, unless you're a third shifter or second shifter, at the time that you usually wake up, because that's when erections and testosterone is supposed to be the best. And if you're low at the best time a human's supposed to be, then we know you're low for sure. Because... when I take testosterone blood tests, I always want to include estradiol. So just to get on the fact that men make estrogen too, estradiol to testosterone. If the testosterone to estradiol ratio is, it's supposed to be 10. And if it's greater than or less than that, then there might be a little bit too much estradiol. So I don't want to talk about the semantics for that. This is just for helping Connor figure out what could be the causes. And here's a couple of things I jotted down. So, obesity, unfortunately, is a cause for, let me get on this side, low testosterone. So when you have low testosterone, or I should say when you're obese, you usually have a lot of adipose tissue. And adipose tissue, as you probably know, will create a lot of estrogen. So testosterone is supposed to be made in the testicles. And when you have just the right amount of estradiol or estrogen, that's cool. When you have a lot of extra adipose tissue, whether it's visceral in the belly or subcutaneous all over, that fat tissue is going to make estrogen by itself. It's not going to make testosterone, so you're going to have an abnormally high amount of estrogen, and that's going to wipe out or negate, just like that ratio I told you about. It's going to negate the amount of testosterone you make, and relatively, it'll shut down other things, especially in the brain, FSH, LH from the pituitary, and that will lower your testosterone. So, the problem is low testosterone from obesity will make you gain more weight, make you lose more muscle mass, and then I'll get you heavier and make you more obese to lose more testosterone. So it's a terrible cycle. I can override that just by overdriving you with higher levels of testosterone. Obviously, you want to lose weight, maybe forcing you to exercise, resistance exercise, just don't get hurt. Maybe melting away that adipose tissue and giving you an estradiol or estrogen blocker. So it can't give you an estrogen blocker that will stop what's coming out of the fat. We can burn up the fat, but we can give you an estrogen blocker if I give you a decent amount or a higher than physiologic amount of testosterone. I don't want the body to convert that to estrogen, so I'll give you a blocker and it'll at least keep the T high, keep the exogenous estrogen low, and then we'll have to deal with the estrogen you make from the fat cells. So that's why I'd say before you turn, you guys that don't have any issues while you're in your 20s and 30s, before you turn into your 40s and 50s and 60s, try as much as possible not to accumulate 3 to 5 pounds every year, because that seems to be it, especially as you're a dad or you're taking on a new job or you're taking on a lot more stress. Everybody always finds that exercise, eating right, is going to be low priority. So they got to work and they kind of put that down. Then they gain weight a little bit every year. You don't even notice it until bingo, you notice that, hey, my erections suck. And then I test it, and yeah, hey, welcome to 50, but you're only 20. So obesity, we'll work on that. But I will tell you right now, even if I give testosterone to take care of low E or low T, you have to start working your ass off, because otherwise you're going to be on testosterone forever. And if you keep up with the obesity and you just use testosterone, I can guarantee you one of these days, insurance is not going to pay for testosterone and you're going to have a problem. So while I have my guys on testosterone, I am coach, or at least I'm head coach, and I can get you guys to find your other coaches in psychology and physical therapy, personal training, nutrition, but you got to kick some ass. I'll give you 1 to 2 years boost. If you can't do it on your own in 2 years, I don't know if we're going to continue with the testosterone. So, other things that cause testosterone to be low, sleep apnea. And sleep apnea usually goes with obesity. But sometimes you can have just people that are not so heavy with the BMI, maybe a BMI of 26 to 28, but just have huge tonsils or a stuffy nose, broken noses from before, stuffy nose from work. And that'll cause the sleep apnea. Rarely can you have obstructive sleep apnea inherited and be skinny as a rail and just have problems, but it can happen. But either way, if you fix temporarily the sleep apnea, the testosterone might come up and you won't have to pay for your testosterone and give yourself that weekly shot. So I also suggest, I highly suggest using the bioidentical cream first. I like the compounding pharmacies around me, and I think the cream is good, a lot less invasive, especially if you're doing do shoulders, or you're going to work an exercise routine and you have to give yourself a shot on Sunday. The exercise routine on Monday is going to hurt. Even if you give a glute shot, if you do squats the next day, it might hurt. Probably not. A lot of my guys that take the testosterone injections, they don't complain because they probably love the effect of the testosterone. It goes straight to the blood, stays in that muscle for a week, and then you get yourself another shot. Anyway, I always suggest topical first if it's affordable. Sleep apnea, fix the sleep apnea. Take care of the obesity if that's the cause of sleep apnea. Bring up the testosterone with exercise or exogenous injections and cream, and then maybe if you get fine-tuned enough, we'll pull you off the testosterone and you'll be fine to make your own. Hey, by the way, even if blood levels are normal, if you have the symptoms, obesity, depression, hair loss, erectile dysfunction, decreased desire, it might just be that you still can have symptoms of low testosterone. You'd still benefit from T. I wouldn't give that much. Whether I start out at like 200 milligrams to 400 milligrams a day topical every morning, or the injectables at 200 to 400, working my way up to 1,000. It'll go. I'd go lower. I'd start lower and go slower with folks who have normal T, but all the symptoms in the world. That's after ruling out any other disease process, diabetes, thyroid disease, anemia. So we got to look into other things. Chronic illness. So say you have Lyme disease. Say you have polycystic kidney disease. Say you have a brain tumor. The chronic diseases and the muscle wasting that are associated with those diseases can cause problems. I think even psychological diseases like PTSD can cause issues where the gonads figure, hey, we're fighting a fight. I'm trying to survive. I'm not going to worry about procreating and making the species continue. We're going to worry about making it through the next day. So sometimes the priority for the body would be, no, we're not making testosterone. We're not ready. We're going to turn off the testicles and we're going to put more into the immune system, something like that. Chronic illness can do it too. You might be a prisoner to chronic illness, but as long as you try to, thus the reason why we always have to, even if you have a chronic illness, you always have to think 12 months, 6 months down the line and see where your projected course is going to be. It's sometimes very frustrating and it just beats people down as far as the morale when they know that they're going to have chronic disease. They don't want to be involved in anything. I'll just take my medicines. I'll just do chemotherapy. So it's really a morale breaker when your doctor says you're going to have this forever and you're going to get worse and you're going to need surgery. Or, which I just heard the other day, you have 2 months to live. It's like, Christ. Anyway, chronic illness can cause it. So sometimes repairing the chronic illness, again, and most chronic illnesses are based on obesity, high BMI, eating the wrong way, no exercise, stagnant activity, unneutralized stress response. So it always is important, no matter what age, whether you're deep into low testosterone to have a healthy lifestyle, or you're anticipating low testosterone and you're ignoring the signs and symptoms of obesity, stress, poor sleep, sedentary life. You always have to have a well-balanced life. I don't care what age you are. So the earlier you get started, the healthier you will be. I started bodybuilding when I was 18, and I've always loved to run. Sprinters like muscle. Sprinters don't like to be heavy. And so I've always kept that idea. I've wavered for a little bit when I was stressed out from working Central DuPage Hospital, but I shouldn't have let it do it to me. But I've recovered from that. I'll never let that happen again. So I've learned from my mistakes. So we all should. So other things: overtraining. If you're at the opposite end of the spectrum and you're overtraining. Sometimes I had a guy that came in today, 3-hour workout per day, and I'm thinking, holy crap, he's got a 9-year-old, he's got 2 college kids. So maybe that's part and parcel of his neutralizing the stress. He's a truck driver, and that's okay, but I would always think 3 hours, we can short tail that, push harder, get done in an hour and a half, be wiped out, and then have more free time for the kids, or maybe seeing a movie or something like that, or meditating. Hey, what a novel idea. So overtraining can do it too, because again, the body thinks you're in fight or flight stress, so it's not going to want to do anything in particular as far as procreating. Extreme weight loss. Again, that's self-explanatory, almost like overtraining when you dump a lot of weight suddenly because you're doing 1 meal a day. And I have an addendum to my 1 meal a day, which I think is actually okay. I'll post it tomorrow. So for those of you who follow me, extreme weight loss can also lower your testosterone, but hopefully the extreme weight loss will be temporary, and the testosterone that goes low will be temporary. Exogenous estrogen. So if you're taking estrogen, why are you taking estrogen, first off? But it can be in soy. That's a theory, that if you're taking too much soy, it kind of stimulates estrogen receptors in the bad way. I don't think that does. I wouldn't do soy isolates. I would do natural things: tofu, edamame, tempeh. So taking the soy hot dogs that are sold in colleges and high schools, no. So I think that sometimes the worst case scenario, you might get this if your wife rubs estrogen on her body and you hug each other in the morning, if that happens at all. Just like if you use testosterone topically before you leave and you hug your kids or you hug your dog or you hug your wife, you're going to transfer that testosterone to their skin, so watch out. Another reason why you might want to do injections instead. Anabolic lookalikes. So Mark McGwire or some of the baseball players got blamed for taking anabolic lookalikes. They were herbs they didn't know they were taking, but yeah, right. So sometimes if you're doing things to boost exercise, that's why you have to be very careful about who you buy. It can actually have anabolic steroids, traces of anabolic steroids in them, and that'll knock down your own production of endogenous steroid, like testosterone. Prednisone is not really an anabolic steroid, but people who have recurrent problems with skin rash, joint pain, asthma will get prednisone a lot, and that can also fool your body into thinking no more testosterone. So side effect, I mean, usually it's a necessary evil, but if you can avoid the steroids so much, it'll be better for you. The one that nobody wants to hear: alcohol and weed or marijuana. Now, I'm a big proponent to using medical cannabis with a lot of my patients, but it does lead to low testosterone. But at the same time, if the medical cannabis is for the medical problem of post-traumatic stress disorder, if it calms down the post-traumatic stress disorder, you can have sex again. So it's a plus-minus there. Alcohol, I don't like alcohol. I have beer. I love the taste of beer, but it does not serve me. It just bloats me, and I need more and more. So I think this is bad, but unfortunately it's so much a part of the society and going out that it's hard to avoid. But that definitely causes problems with low testosterone, so watch it. If you're doing a tea and then you're going out and having a beer every night, you're defeating the purpose. So, and then finally opiates, but that's why we have medical cannabis, is to avoid the opiates. This stuff leads me to also tell you that there's also problems with certain medicines that cause low testosterone, chemotherapy in particular, but assuming you're not doing any of that stuff, I think you're okay. So those are the things that cause low testosterone. If anything on the list seems like what's going on with you, you might want to ask your doctor. or Connor, you might want to tell me. But if we can neutralize the list, if we can make the testosterone a little better, whether it's topical every morning or injectable every week, I'd say while we get used to the dose, after the first 3 months, take it easy. After 3 months, I'm going to be on you as far as exercise, proper sleep, proper eating. You don't have to be vegan, but mostly whole food plant-based diet would be important. Not too much of the meat, because some of the crappy meat that's out there is probably got full of steroids. And as I told you before, anabolic steroid lookalikes can be also in the form of what your meat got or what your beef or pigs got. So be choosy about where you buy your beef and your hamburgers and your pork. And your chickens for that matter, but they're probably not given steroids too much. So hopefully this gives you a little idea. Those of you who use topical testosterone, whether you use the estrogen blockers like an Anastrozole or not, please put your comments down below on, hey, how much you pay. Because in Illinois, there's a wide variety of different payments. Most insurances pay for injectable. Most insurances don't pay for compounded creams, but I love the compounded creams because you can mix a couple different things in there too. So, and it's so easy. It's just compliance is an issue. So hopefully you guys can give comments to help Connor, maybe help each other. Otherwise, don't forget to subscribe to me, and I'll see you at the next Minute Clinic.